Chief Medical Officer, gynecologist, and women's health expert, Dr. Jessica Shepard. What screening should men do with their doctors, and should they also do self-examinations?
Self-examination is always very important because what that empowers a patient to do, whether they're male or female, is paying attention to their body, like we heard in the story before. And also, when you're going into your doctor, it's not to go in when you have something bad. The annual really is to go even when you feel well, so that you can start the conversation and what things can happen. And for males, that can mean talking to their doctor and doing the appropriate care through self-exam, but also having your provider do that exam for you.
Dr. Shepard, according to the American Cancer Society, since the start of breast cancer awareness initiatives back in 1985, over 517,000 lives have been saved from better treatment and proactive screening. The 5-year survival rate for a woman diagnosed with breast cancer has jumped up from around 75% in the early 80s to over 90% in the past few years. What are the biggest changes in the last 40 years, and what progress has been made?
Yeah, so much progress has been made, and a lot of that has to do with awareness. Again, you'll hear that people don't even realize that they may be someone who could get breast cancer. And I think that most people allude it to having some genetic predisposition, and that is not always the case. When we look at actual breast cancer rates, a lot of them are just from the general population of people. So there are risk factors that can increase your risk of having breast cancer, namely age, or even things such as alcohol use. Now, when we look at the years 2018 to 2022, about 2 in 3 female breast cancer cases were diagnosed at the localized area. So that means that it hadn't spread. And what this means is that people will have more likelihood to survive, even a 95% chance of living 5 years after a diagnosis. So these are all really good instances in where we can see the diagnosis, such as having mammograms and early detection, and also the treatments that are available.
There's also some new guidelines about screening for breast cancer if you have dense breasts. What are those new guidelines?
Now, the guidelines really are in the actual imaging. We have better imaging through mammography that really do 3D, looking at dense breasts better, because the dense breast tissue can sometimes hide some of those microcalcifications that typically will show on imaging. So really how that changes is if someone does have dense breast that is seen on imaging, is to actually communicate that with the patient so that they're aware. Again, this goes to awareness, further conversations, and maybe even possibly more screening for people who have dense breasts.
HER's Chief Medical Officer, gynecologist, and women's health expert, Dr. Jessica Shepard. Thank you.